Hi, this is MK from Apter Institute, and today's video is about TMJ disc displacements. In order for us to understand how displacements occur, let us look at how the jaw works. Now, in this video clip, you can see the lateral aspect, you can see the temporalis muscle, the masseter muscle, the superior head and the inferior head of the lateral pterygoid, and you have the mouth opening muscles like digastric, mylohyoid, geniohyoid, and the disc mandibular complex here. Now, this blue color denotes that the muscle is in a state of relaxation, and during contraction, the muscle color will turn pink in this video clip. Now, for mouth opening or depression to occur, first, the opening muscles, which is the geniohyoid, the hyoid group of muscles, and the digastric contracts along with the muscle which pulls the condyle forward or translated forward, which is the inferior head of the lateral pterygoid, while the superior head stabilizes the disc throughout the movement. So you can see that here. Right, that's contracting there along with the inferior head of the lateral pterygoid during mouth opening, right? So the muscle being pulled for the condyle and the disc being pulled forward, right? And the inferior head of the lateral pterygoid provides that protracting force for the condyles and the disc to track forward. And the closing muscle, which is to elevate the jaw, are the temporalis and the masseter. So you can see that happening there. All right, now let's look closer into the joint. Okay, now we can see that the, let's click that first. Yeah, you have the condyle there, the mandibular condyle. You have the mandibular fossa of the temporal region. And then you have the disc. And we can see that during movement, the disc actually will track along with the condyle. You can see that the disc tracking along with the condyle, and posteriorly the bilaminar zone fills the void when the disc tracks anteriorly. And you can see that the inferior head of the lateral pterygoid contracts to stabilize the disc, while the the superior head stabilizes the disc while the inferior head moves the condyle forward. Right, so this line is just showing the position of the mandible along with the temporal region, and you can see that the centric relationship is also always being maintained in the intermediate zone between the posterior anterior aspect of the condyle head and the intermediate zone. Right, now let's look at how a displacement looks like. So again, this is the normal jaw movement happening, the normal jaw movement happening. And as the disc now displaces anteriorly, due to many causes, can be muscular and other causes also, few things happening. The lamina posteriorly are being stretched, okay? And we can see that the posterior band of the disc actually moving anteriorly, which again displaces the condylar head more posteriorly. And this, what does this does? This will actually squish or compresses on the posterior lamina and also at the bilaminar zone. And you can see that the centric relationship between the mandibula is lost. So when the jaw opens, the condyle actually jumps into place, often causing a clicking. So see, and then it jumps back, causing a clicking during closing. So this is this displacement with reduction, which means the disc again comes back to its position. So it jumps with the opening click and closes back with the closing click. Now, when further progression of the disease or the displacement, you can see that the disc is now interlocked between the condylar head and the articular eminence. So what happens is, now during the tracking, the disc does not allow the mandible to translate forward. So this is called disc displacement, without reduction, or we can call it as a closed lock. And further progression of the disease, we can see that the disc contracted there, and the bone is rubbing on the, so the bone of the mandibular head is rubbing on the bone of the mandibular fossa. So there's, which again can cause arthritic changes, degenerative changes, and eventually cause temporomandibular joint arthritis when it's not addressed properly due to the bone-to-bone rub, right? So what we have seen here is a snippet of what we actually teach in our temporomandibular joint courses. So for further information, please contact Apter Institute if you want to learn more about the temporomandibular disorder or how to manage temporomandibular disorder in your practice. And it's quite a niche population, which you will be able to tap into, as there are so many clients or patients who actually suffer from these conditions and do not receive proper management because they do not know who to approach, or they have been misled by certain fraternities into thinking that there is no other approaches to help them with this disorder. Right, thank you very much. And please log on to also our YouTube channel, Apter Institute YouTube channel, for more videos like this. Thank you.